Well, we're going to take it on now here in the studio with Dr. Asil Jallad, who's an obstetrician, a gynecologist who worked in Gaza earlier this year. In fact, I think you've been twice, haven't you? You went once, 5 months just after the war started, and then more recently around about the time the ceasefire ended.
Yes.
So how different, what was the difference between those times?
Thank you for having me, Nick. The first time I served in the south, it was between Rafah and Khan Yunis. And there wasn't land invasion yet. So you had partially working hospitals, and I served in a field hospital back then. So most of the people I served were the people displaced from the north to the south. And back at that time in the Mawasi, it was a highly dense population, highly populated area with the internally displaced people in there. And we had some equipment to work with, but it was very swinging at that time. So some days you had something to work with and operate with, and sometimes you don't have anything. And same applies to the medication. The second time I went there with a mindset that it was a ceasefire. And that was where the need for me as an OBGYN was at that time.
Of course.
We went to basically continue or fulfill the work that was left over during the months of war. So we went there with a mindset that we need to cover and we need to maintain whatever was left all during the past year. The elective surgeries, the gynecological problems the women had, the surgeries that were postponed until the war is over, theoretically speaking.
But then the offensive started again.
It was 1 week during my second stay when they broke the ceasefire, and it was one of the worst days and still is currently the worst duration or the worst days of the war that is currently happening, because remember that no aid has been going in, and that includes no medical equipment, so nothing. And when it was a ceasefire at that time, we used what we had for all elective procedures because we thought we won't need it for bad emergencies. But then a week through that period, they broke the ceasefire.
And since then, of course, nothing's gone through, pretty much. And now we have all hospitals out of action. So we can only imagine just how terrible it is.
Yes, the hospital I served in the second time, it was the only hospital providing OBGYN services. So basically, it was the only hospital. We had the primary points and the primary healthcare points providing relative care. And when I speak of relative care, it's basically because the situation is very dire and everything is lacking in Gaza. Every single woman is diagnosed with malnutrition, and every single pregnant lady is basically classified as a high-risk pregnancy. Every single woman is having or suffering a complication one way or the other. And the hospital I was in the second time, it was basically the only hospital or considered a tertiary center that's providing services to women in the north. So it basically catered for over 400,000 people in the north of Gaza. And now
so now they're out of action.
Nothing.
So what is that going to mean for people for women who are giving birth, for example?
And it was really hard all through for women. Imagine being pregnant and laboring and not knowing how to get to a hospital because there's no safe way to get you to the hospital. Even the ambulances, after targeting most of the ambulances in Gaza, you don't have an actual properly functioning ambulance with a facility or with ability that can deliver you in the ambulance to deliver you in the hospital on time. That's one. Some women opted to go for a cart that's pulled by a donkey or a bike or whatever. Some of the women ended up walking in immense darkness because there's no electricity all through. And some women, I remember before I went the first time to Gaza, I helped lay people delivering women over the phone.
Wow.
And
so you would talk them through it over the phone?
Yes. Because, again, that is it. Some women delivered in tents. And I had stories from my colleagues over there in Gaza being called in the displacement camp by random people in a tent looking for a doctor because there was a woman laboring in there and there's no way of getting her to a hospital. And so that's the situation all through, added to the struggle and the challenges of war or the war imposed on these women. I'm telling you, every single woman is lacking the basics of care. A pregnant woman, a growing up woman, a growing girl, because again, we tend to forget that women do not just complain of pregnancy and giving birth. There's so many other health issues that are being dismissed and are being ignored and underestimated. And every single woman goes through such issues.
And I guess the actual experience of childbirth must be incredibly challenging. And in some cases, they don't make it through, right?
Yes, and as I told you, most of the women are classified as high-risk women. All women are malnutritioned. All women are malnourished. Most women are diagnosed with anemia. I remember one day we had a woman walking in the clinic, and I thought she looked earthy. To me, she looked ill. So my colleague was sitting next to me. I'm like, I asked him, can we run a blood check on her? And that was the rapid blood check. And she had a hemoglobin of 4.3, and she was 7 months pregnant. And she walked.
What does that mean, hemoglobin of 4.3?
That's severe anemia. So basically, if you have a hemoglobin level that's less than 7, you most probably need blood transfusion.
So it's incredibly dangerous.
Yes.
Yeah.
So if she goes into delivery or she goes into birth at this level of hemoglobin, she'll definitely die. And added to that as well, these women are all under stress. And we know, and it's been proven, that high levels of stress do pose a risk at women, a risk of miscarriage, risk of preterm labor, and a risk of aggravating every single health issue a woman is diagnosed with. And imagine not having the ability to actually control the complications these women are going through.
Of course. And the finding out you're pregnant, normally such a joyous moment. And I guess it still is in a way, but it must also be wrought with fear and worry about what's going to happen.
It is. We can't deny these women, and they still are happy with their newborn baby. And I've seen it every time I delivered a woman. She would ask that she is the first one who holds that baby. She wants the first moment with this baby, despite the background noise, despite the bombing in the background, despite knowing that she might go home and she doesn't know if she's going to actually get home safely, despite the fact that she knows that she might be unable to feed him properly or care for him properly. Yet, it's that thing that just comes in by instinct. She just enjoys her newborn baby.
And what a world that they're being born into, these children.
Indeed,
right now.
but then again, what's happening in Gaza now, do you know that until the end of January 2025, 67,000 deliveries happened in Gaza since October 7. If that tells you something, it tells us that we need to keep this going. We need to keep defending these people and fighting for their rights to live, because this is what they're doing. We would assume that being in such a situation, no one would look into or want to get pregnant and want to deliver. But yet again, we had women coming into clinic and asking for methods to help them get pregnant, especially those women who struggled with infertility throughout the war. So yet again, these people are holding on to every single bit and hope of life.
We'll have to leave it there, Dr. Asil. We do appreciate you coming in and telling us this. Well, it's really a tragic story, isn't it? But perhaps one of hope down the line. Thank you so much.
Thank you. Thank you, Nick. Thank you for having me.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.